How's it going? I'm going to answer the biggest question that you probably have, which is what's the best treatment for your hip pain, for your back pain? Is it physical therapy, chiropractic, acupuncture, massage, something completely different? And how do you know? How do you know what the best treatment for you is? So I'm going to give you a simple way you can think about it. And although I am a physical therapist and I help people all over the world virtually, either as a physical therapist or as a persistent pain coach, get back to doing the things that they love to do, I'm going to give you an unbiased answer. And really the bottom line is, how long does that relief that you get last? So if you go to your physical therapist, chiropractor, massage therapist, acupuncturist, whatever it is, if you go there and you get some relief, that is a good thing. The key is, how long does that relief last? And does it bridge you to your next appointment? And there are plenty of people who can go to these sort of treatments, get worked on, get something done to them, get a window of relief that lasts them until their next appointment. Maybe that effect fades a little bit, but not all the way. So they still have some residual positive effects, and then they continue to build on that going session after session. So if that's you, perfect. You might have noticed that maybe that's not the case for you, and you get some relief, but that window closes. Then you either need to do the treatment more often, or you need to find a treatment that gives you a longer effect. So it's either one or the other. Your goal to beat persistent pain is keep that window of relief open long enough for your body to recover, long enough for your body to heal. And the only way you do that is either finding the treatment that keeps it open the longest, or by doing the treatment often enough to not have to worry about how long the effect is. And so you are limited by the treatment that you're doing. Of course, if you're only getting a couple hours of relief with physical therapy or with chiropractic or with acupuncture, you could try doing another treatment and seeing if you get a longer relief with another form of treatment. But the more effective thing to do is figure out, well, what sort of exercises, movements, self-treatments can you do to get that same amount of relief, so that way you're empowered to keep that window open and you don't have to rely on somebody else. That way, even if the relief you get only lasts a couple hours, well, guess what? If you're getting it through finding the right exercises for your body, finding the right self-treatment strategies, then you can do those things again that give you relief before that window closes. Versus you can't just go 3 hours later back to your physical therapy, back to your chiropractic. And of course, that's why I'm a big proponent of a movement or exercise-based solution, because a lot of people just don't know that this is a possibility and don't know that you can find the right exercises that replicate the same positive effects that you get from an adjustment, that you get from manual therapy from a physical therapist. And it requires a lot of testing, but once you find the right things for you and your body, then you're empowered to not have to rely on others to keep that window open. So really that's it. The treatment that you're doing, how long does it give you relief? Does it give you long enough relief to bridge you to your next appointment? If it does, then great, continue to do it. If it doesn't, then you need to either look into other options, either within that subspecialty. So maybe you're already seeing a physical therapist or a chiropractor. Well, what other treatments can they do or try to help give you relief longer? Or what else can they implement or have you implement to keep that window of relief open between visits? Or what else can you do, maybe on your own, so that way you don't have to rely on them? And that's your goal. Keep this window open. If you're having trouble doing that and you're not sure what exercises or things you should be doing, I'll put a video in the description or in the caption somewhere or in the comments somewhere of a video that walks you through a framework or a process where you can figure out the best exercises for you. And let me know, what have you found to be the most helpful for you in terms of either treatment that you've been doing or exercise that you've been doing? And if there's anything in particular you want me to talk about in a future video, feel free to drop it in the comments. That's all for today.